Good evening, everybody. How are you today? So, this is Dr. Beena Wagle with another episode of Wednesdays with Dr. Beena Wagle. And before I discuss about the topics, like many people said, "Ma'am, आजकल आप बात नहीं करते हो, आप बहुत serious हो गए हो." So, no, I'm not serious. I'm very much interested in talking to all of you. And yes, there was a complaint that I don't introduce myself, so the people, many of them don't know who's the doctor. Is she a doctor, or she's into theater, or is she a motivational speaker? So yes, I am Dr. Beena Wagle. I'm a homeopath, I'm a dietitian, I'm a counselor, a motivational speaker, and a mental wellness advocate. So quite a lot of hats. So for those of you who don't know me, today I'm on Wednesdays with Dr. Beena Wagle, and we had started this thread in the COVID situation to promote mental wellness, and people liked it and have requested that we continue with it, and we also include physical wellness topics. Hello Pallavi, thank you. Hi Asta, good to see you. So we decided to include a few physical wellness topics, and generally the way I perform or the way I function is that a lot of you send me pings and emails and messages, and what I do is I pick up a topic suggested by you. Okay, so we've exhausted almost I'm saying not almost all of the mental wellness topics, and now people have started suggesting physical wellness topics. So the last two topics that we did were physical wellness topics. I think it was hypertension, and I think it was before that also we did a topic I did not really able to recollect right now. But today's topic again is a much demanded topic, and a lot of us have heard of either people suffering from it or we ourselves have gone through it. And I personally in clinical practice would say that this is one of those situations which I class as really painful ones. Okay, so we have chosen the topic today, renal calculi or kidney stones. Okay, so kidney stones is a topic which is very common these days. Okay, also there are a lot of myths surrounding this topic, so I'm going to enjoy debunking all those myths. Also there are there is this myth that once it is done, it doesn't come back, but sadly, no, it does come back. So there's a lot of things to talk about, and a lot of questions also I have received. Plus, some of you have given suggestions as to what to include in this talk. So completely as requested by you, this topic is going to be taken up. And without any further delay, I'm going to start. Oh yes, I was asked to wait for a couple of minutes before I start the topic because some people cannot join in exactly at 6. So ma'am, आप थोड़ा 6, 5, 6, 10 तक wait कर लो. So it's just 6 o'clock. So tell me people, how has it been this I think the last week was quite a bad week with lots of rains, and there have been a lot of things happening worldwide also. Plus there's a lot of negativity around, and complaints, and people are finding it difficult to really come back to normal and settle down. So if at any time you feel that you want to discuss or you want to talk to a friend, you can always ping me, and I think I should start. I'm not much for small talk. So coming to today's topic, the topic is renal calculi or kidney stones in simple language. So how do you define a kidney stone, or what is a kidney stone, and how does a stone end up into a human body? Okay, so I'll put it in the simplest possible way that I can, and I hope you guys understand. So what happens is, in the human body, whatever you eat is processed, and certain byproducts or waste products are thrown out of the body once the nutritional value from those substances is obtained. Okay, now there are a couple of things which are byproducts of digestion, and they are acids, they are proteins, they are actually they are acids which are byproducts of protein. So there are a lot of minerals or a lot of salts in our body, plus these acids which are there. And now what happens is there are sometimes some debris, cellular debris. Okay, so bits and parts of certain organs which wear off or which are shed off, and these cellular debris are also present in the body. Now what happens is when this cellular debris combines with certain minerals and certain acids, they slowly start forming a nucleus. Okay, so this nucleation process could be homogeneous or heterogeneous. So there are two types of stones that are there. Homogeneous matlab ek hi cheez ka bana hua patthar, and heterogeneous means there are different substances which are mixed in that one stone. So you can have, so the first step is where nucleation occurs. So some cellular debris gets attached to some of these things and it multiplies. Okay, now this slowly forms a crystal. Now this crystal is thrown from the nephron or the cell of the kidney where the purification of the body takes place, and it is thrown into the urinary system. Okay, so urinary system mein jab ye stone aata hai, okay, then it becomes further bigger and bigger. Okay, now once this stone is thrown into the urinary system, there are two junctions where generally they go and get impacted. Okay, or they go and start getting blocked. Okay, so that is the uretrovesical junction or the uteropelvic junction. Okay, and that is when the pain starts, and that is when you go for a test or you go to a doctor and you realize you have a kidney stone. Till the time you are mostly unaware that you have a kidney stone या फिर ऐसा कुछ हो रहा है body में. So like I told you, there are different types of kidney stones. Okay, so there are 5 types of stones, and they are calcium oxalate, calcium phosphate, struvite, okay, uric acid stones, which are pure uric acid, and cysteine stones. So cysteine is a type of a byproduct of a protein. Okay, so pure stones are uric acid, struvite, and cysteine stones, and the combination ones are calcium phosphate and calcium oxalate. So calcium along with phosphate and calcium along with oxalate forms these stones. So now that we know what are the stones, okay, let me define the different types of stones for you. So kidney stones are defined as hard deposits. Okay, they're very hard deposits of minerals and acid salts that nucleate. That means they form a nucleus in concentrated urine. Okay, so when your urine is very concentrated, there are chances of you getting kidney stones in the nephron or in the kidney, and then they pass through the urinary system. Okay, now why are kidney stones essential? Not essential, I would say why knowledge about kidney stones is essential. Knowledge about kidney stones is essential. One is because they are very painful and they can hamper your lifestyle. 2, because they are completely curable. 3, because they can cause obstructive problems. Okay, so in the kidney, if you have an obstruction, it could cause a retrograde or a back infection into the kidneys, or it could cause you immense pain and problems. So knowing about this is being, they say forewarned is foreprepared. So you are ready when you face it. So you know exactly what is happening and there is no panic. Okay, so that is what a kidney stone is. Now, what are the causes? Who gets kidney stones? Why do we get kidney stones? Why do only some people get kidney stones? Okay, so when you say causes of kidney stones, there are several causes. Okay, so I will begin with people in which, first and foremost, the urine is concentrated. Okay, so people who consume less of water. Okay, and there is more of substances like calcium or cysteine or oxalates or uric acid or It's true white. Okay, so when there is more concentrated urine in the body, you can suffer from kidney stones. Now this concentration can happen because of lack of intake of fluids or water, lack of hydration. It could be because you're dehydrated, okay, or it could be because of deficient intake of fluids. Now also people who lack in inhibitors means something which stops the formation of stones, which, see, the body, the human body has been naturally made in such a way that all the diseases can be countered by the body itself. Now if you do not have this inhibitor, okay, if you do not have these inhibiting substances, or you lack in these inhibitors, then also you can get kidney stones. Okay, so what are these inhibitors? Okay, so this inhibitor is citrate. Okay, citrates, when they are present in the desired amount, they will prevent the formation of stones by combining with all these, waste products and throwing them out of your urine. Okay, so lack of citrate inhibitors, concentrated urine. Third, people with metabolic disorders. Now, what is metabolic disorders is a huge topic by itself, but they are disorders where certain substances are not absorbed into your body, rather they are thrown out. One of which would be calcium metabolism disorders. Okay, so let's confine it to this right now because it's a huge topic otherwise. Okay. Fourth is people with nutritional factors. Now, where there are nutritional factors included. Now, what are the two nutritional factors that you would have to be cautious about? One is people who have a very high concentration of animal protein in their diet. Okay, and two is a diet which has got too much of sodium. So if you're using too much of salt, for the layman, it is salt. If you're using too much of salt in your diet, also, you are predisposing your body to kidney stones. Okay, so these are the two nutritional factors. Now, people who consume less of water, okay, water consumption जिन लोगों में कम होता है, or who are predisposed to dehydration because of climatic changes, like in a humid climate like Goa, or Karnataka, or Mumbai, Maharashtra. So coastal areas where it's very humid and there is a lot of loss of fluids from the body due to sweating. Okay, these climates or these places are more predisposed to people with kidney stones. Okay, also people with predisposed conditions like low blood pressure. Now these people dehydrate very fast. So you can also be predisposed to kidney stones. Okay. People on medications. Now, a lot of us have been taking vitamin C unjudiciously just because, we are scared of COVID and somebody says that vitamin C helps in building your immunity and fighting against colds and infections. So, indiscriminately, we take vitamin C. Yeah, but vitamin C also causes less of citrate absorption or less of citrates, and therefore you can predispose yourself to kidney stones. So in the right now COVID situation, a lot of people have been getting kidney stones, and a lot of patients have come to me with kidney stones simply because of this, a lot of consumption of vitamin C. Okay, now if we have to come to the next way. Okay, so what are the symptoms of kidney stones? What are the symptoms that we need to know about kidney stones? Okay. Generally, we have no knowledge about kidney stones because we are asymptomatic till the pain starts. Okay, so once the pain starts, the pain could be either unilateral, that is one-sided, or bilateral, which is both-sided. In the back, okay, so essentially here, just below your rib cage, when the pain starts, and that pain is especially radiating pain to the groin. Okay, so to the urinary area or to the to your private area, that is the suggestive symptom of renal calculi. Okay, this pain is spasmodic. Okay, so it is not like it is there continuously. It's like a dull ache and it comes in spasms. Okay, so you will feel it there and it eases, there and it eases. It's like a spasm. Okay, you could also have blood in your urine. Okay, you could have nausea and actually vomiting also. Unexplained nausea. Suddenly you start feeling nauseous. Like, you are just going to vomit. Foul smelling urine. The urine starts smelling very strong and very, it has a very strong odor. You could also have chills and fever. Okay, you could have burning urination, or painful urination, or frequent urination. So all these are signs and symptoms of kidney stones. Okay, also in severe cases there might be urinary obstruction. Okay, so the flow of urine becomes less, there is swelling in the urogenital region, and there is pain. So if you are having all of these symptoms, then you need to go and get yourself examined. Okay, so far so good, everybody is understanding? Okay, so now how do you diagnose? How do you diagnose that you have kidney stones? Okay, now diagnosis of kidney stones generally happens through 2 or 3 things. The commonest one that is done is your urine analysis. Now urine analysis can be done for crystals, for blood, and for white blood cells. Okay, blood analysis will be for presence of calcium, phosphorus, uric acid, and electrolytes. Okay, if you want to be even more thorough and you want to know the exact location, or your doctor advises you, the best is to get an abdominal sonography done. Okay, so if you get an abdominal sonography done, you know exactly how many stones are there, where they are placed, whether they are causing any obstruction, and you can also, if you have a skilled clinician can also predict how much time or how long is that stone going to actually trouble you. Okay, so if the stones have been passed, then you can also determine the kind of stones by looking at those stones. Okay, so what is the treatment? The treatment is hydration. Okay, consuming lots of water and fluids. Okay, consuming citrates. Okay, so you start consuming citrates. Now I will come to all these foods which are rich in citrates. And also there is some patient, I guess, who is calling me. Also consumption of, I said hydration, I said consumption of citrates. Lithotripsy. Now lithotripsy means it's a surgical procedure wherein the stone is actually crushed. Okay, or a ureteroscopy. So through the ureter, a scope is passed and the studies are done. Or tunnel surgery, where a small incision is done and the stone is removed. Okay, along with this, what we suggest is certain lifestyle changes. Now, what are the lifestyle changes? The lifestyle changes are becoming a little more active. Okay, so it has been found that people who are very active generally do not get kidney stones. Sleeping early, this is also very important. I shall come to why a little later. Consuming less of animal protein. Okay, these are the lifestyle changes. And along with the lifestyle changes, some treatment that needs to be done. Ideally, I suggest homeopathy. Why? Because 1, it is safe. 2, it is easy. 3rd, it is a permanent cure. So you can remove this tendency for kidney stones, because it has been found in research that it has been found that if you've got a kidney stone and you treat it by any other method, within 4 years, generally there is a recurrence of kidney stones. Whereas if you treat it through homeopathy and you remove that tendency, there is no recurrence. Okay. Now, we will come to certain, other things that you can do for kidney stones. Now, suggestions of 8 ways to cleanse your kidneys. So consuming certain things will cleanse your kidneys. Now, what are they? It has been found, and now these are not my claims, this is research which is there. So consuming Apple cider vinegar helps in treating kidney stones. Okay, consuming kidney beans also helps in cleansing your kidneys. Lemon juice is known to be a citrate former, so it removes kidney stones ka tendency. Watermelon is a natural diuretic, okay, but at the same time it does not strain your kidneys, because what it does, it combines with ammonia and it removes it from the system, so helps in protein digestion. Okay, pomegranate also is very good for people with kidney stones. Consumption of dates, khajur, okay, basil, tulsi, variation of tulsi, of course, and dandelion. Now dandelion is a little difficult to obtain, but otherwise all these things are easily obtainable and you can easily consume them in your food and reduce your risk of kidney stones. Now I will come to the hilarious part. Okay, so there are a lot of myths about kidney stones. So what are actually stone forming foods? Okay, this is not a myth, this is the truth. Okay, so if you are aware of what are kidney like stone forming foods, I see some questions here and I think somebody has asked this question also. Yeah, Kaunte Deshpande has asked, does any peculiar food make it concentrated? So I'm coming to stone forming foods. So if you're consuming a lot of these, then you could be predisposed to stones. Okay, so beetroot, okay, chocolate, a lot of chocolate, palak, lot of it. See, now when I'm saying these things, these do not essentially give you kidney stones immediately after you eat.